First, I would like to ask your permission to use this video for educational purpose and on internet.
Yes.
Thank you. Now, tell me, what were your symptoms before the surgery?
I was in a wheelchair
For how long?
for a year,
Okay. How was your
And-
life?
and I couldn't walk.
Mm-hmm.
I wasn't mobile. I had to use a wheelchair to get around in
Mm-hmm.
everywhere I went. I'm 79.
79. There are studies that show if you're your age and you don't walk, your body shut down, literally shut down.
And it
Right.
did, and
And
it
it
did.
did. Tell me about
Yes.
it.
Because he had bladder trouble. He had to have a catheter in for a whole year.
Okay.
And finally, this last, when was it, January?
Yes.
They took the catheter out and
But
he's
so
gotten
you're
better.
recovering, your
He
body's
was
recovering.
Right.
Everything, his body,
Heart,
his whole
lung.
body
Yes.
is feeling better, yes.
This
And
is-
like you said, his lungs, he's breathing better because he's walking more.
Yes.
And I don't use tobacco anymore.
Our body is made for walking. We are mostly
Right.
muscles
Yes.
and
Yeah.
bones, and everything else is to support us moving. And if we
Right.
don't move, if we don't walk, literally our capacity goes down, and that was happening with you.
Yeah, we went to a couple of other doctors before we found you.
What did they tell
He
you?
didn't want to touch me.
Yeah.
He couldn't do it.
Did he tell you why?
His age and
I was
his,
too old
Mm-hmm.
and too many heart problems. I had a heart problem.
Yeah.
I had lung cancer,
Yeah.
and he didn't want to do anything.
well, the reason
So we
they
went to
did,
Sioux Falls.
the reason they didn't want to do it is kind of they would have to do it the front and back.
Mm-hmm.
So, and it would have been too long. It would have been 6 months recovery time.
And the surgery alone would have been like 8-10 hours surgery.
That's what they said.
Yes.
And he was not healthy enough
to
to
go
do
through
that
kind of
because,
surgery.
so then they just prolonged it and then we
Yeah.
heard of you.
Yeah,
And-
but you came to us and we look at your situation, and you had so many problems in the back. But we decided that after we put you through a protocol, that most of your symptoms come actually from 3 of the disc, where your spine has the most of the side bending. You have scoliosis,
Yes.
and we fixed it about a year ago. Is that right?
Yes.
Yes.
Okay.
Yes.
Now, you were using a wheelchair for a year before the surgery. How long after the surgery did you start
Well, I
walking?
walked out of the hospital
Yeah, excellent. And
with a walker, but I walked
yes,
out of it.
yes.
And then I went to physical therapy for maybe
6 weeks.
Yeah.
4 months after.
Okay. So how's your life now?
Oh, I'm up and going shopping all the time.
Okay, and your pain is okay?
Oh yeah,
No
no
pain.
pain.
No pain, and
Uh,
your body is recovering.
Yes,
Whereas
I
many
can
times,
stand in church now.
excellent. Now many times, we doctors, we sort of push the risks away from ourselves or from doctors, meaning that we tell you go live with that because surgery is too risky.
That's
Right.
Many times, unfortunately, we think that's too risky for us surgeon because we don't want to hurt you, but we don't tell you that if you don't walk, your body shuts down. The life expectancy is shorter if you don't walk than if you are diagnosed with cancer in your age group. But that is the part that we sort of out of sight, out of mind, and that is a sad thing. But we did this surgery for you here. We did a 3-level OLLIF. We didn't fix all the levels, but we fixed the levels that mostly contributing to your symptoms. And even though these bottom levels are still in a bad shape, but you're proof that we don't have to fix everything to get a clinical
Right.
results.
And I wouldn't want to either.
Yes,
Because
yes,
it lays you up longer.
yes.
You're
Well, he's
tied
no-
down
There's no pain. so
for
there's-
longer
Yeah.
to get the same results that you get sooner.
Yes, and you just
Yeah.
mentioning what we know from data that bigger surgery
Right.
is longer recovery, meaning you are losing so much condition that
Right.
the benefit of the surgery is offset by the risk of the recovery and the surgery itself. So, and you're proof of that.
If
Okay.
if I had went with that Sioux Falls
Mm-hmm.
doctor before I found you,
Mm-hmm.
I would still be laid up
Yes,
because it was 2 surgeries,
yes,
6 months apart.
yeah. Well,
and I'd still be laid up.
yeah, but you know, I think the advantage of us was that we could do it minimally invasively.
Yes.
And it only took you an hour and a half to get it done.
Our surgery took 1.5 hours, and our blood loss was less than 100 cc, so minimal.
Right,
And
right.
that is a different, that kind of give patient a different kind of recovery than a surgery that's 10 hours and 2000 cc of blood loss, which easily could be the case
Right.
in your surgery. Well, any other comment, any other thing that
Well, we
you
rode in, we had it done in Crookston,
Yeah,
Minnesota,
yeah,
and we rode in a wheelchair, and I walked out
excellent.
with a walker.
That makes me very happy. Well, thank you so
Miracle
much.
worker.
Thank you. Thank you very much for the
Well,
interview.
thank you.